The cost of unhealthy Texans as state leaders take on chronic illness. A deeper discussion with our political roundtable, Edgar Walters from the Texas Tribune and Ashley Lopez from KUT News. Plus, Texas Transparency, your right to know what state troopers are doing on the road.
And given the choice, I would make the same decision again today.
And a week of wins for two Texas politicians. Today on State of Texas In Depth. Hello, and thank you for joining us. I'm Josh Hinkle. The healthier Texans are, the more the state could save. We'll dive deeper into that issue a little later, but first, we begin with a big win in the Badger State. Texas Senator Ted Cruz took 36 delegates on Tuesday. The win was a surprise since Cruz trailed Donald Trump not that long ago. Anti-Trump Republicans rallied around Cruz in hopes that they could prevent Trump from getting enough delegates to win the nomination outright. However, the next Republican contest is Trump's home state, New York, on April 19th. It was also a good week for a former presidential candidate, former Texas Governor Rick Perry. This week, criminal charges against Perry were officially dropped. A grand jury indicted Perry on abuse of powers and coercion of a public servant charges after he vetoed funding for the Public Integrity Unit located inside the Travis County District Attorney's Office. While Perry is now cleared of criminal charges, the damage may be done. The felony hung over the former governor as he launched his failed presidential campaign last summer. Tony Busby, who represented Perry, told KXAN his client wasn't relieved by this week's decision, but instead he questioned how the charges happened in the first place. And this week at the state capitol, lawmakers got a big dose of reality when it comes to Texans' health and how much it's costing taxpayers. The House Public Health Committee heard from leaders at the Health and Human Services Commission about the Medicaid cost for people with chronic disease. Topping the list in a single year, cardiovascular disease at $612 million, diabetes at $300 million, and cancer at nearly $230 million. So how are state and local officials planning to cut down on those chronic diseases? Let's ask Austin Travis County Health Medical Director, Dr. Philip Wong, who's also very involved statewide with the Texas Medical Association. Thank you for being with us.
Thank you.
So how is the state, and really with local partners, trying to battle some of those chronic diseases?
Sure. Well, you know, the three major risk factors for chronic disease are tobacco use, physical activity, and nutrition. And so we talk about making the healthy choice the easy choice, because that's really, it's changing the environment, changing the policies and systems so that these habits and behaviors become the norm. We've had a lot of success with tobacco use. For instance, you know, the policies where you can have no tobacco use on a campus at UT or at Dell or Austin Travis County, a lot of those places have had significant impact on their employees when they've adopted these policies. Like Dell's smoking rates went from 13% down to 3%. And so we're trying to take those same principles to making that healthy choice for getting healthy food options, or that physical activity becomes part of the day-to-day activity. It's not just something they have to go to the gym, you know, a couple of times a week.
Now, I know state lawmakers have really been focusing on this in the past week with a couple of different committee hearings. What would you like to see the state do, you know, as far as maybe something the legislature could try to tackle for chronic disease next session?
Well, you know, chronic disease doesn't get the attention that some of the more high-profile infectious diseases might get, but you look at the numbers are huge for chronic disease, and you think about the number of cases of Ebola we actually had. I mean, it's not very many. And so there needs to be that, you know, investment, you know, in an appropriate amount to address this issue. I mean, chronic diseases account for like 3/4 of the healthcare costs that we face. I think nationally that's 3/4 of the $1 trillion in healthcare that's related to chronic disease.
And you mentioned here in Austin area that there's one chronic disease that rises above the others.
You know, cancer has now surpassed heart disease as the leading cause of death in Travis County. That's faster than the rest of the state. And we used to have heart disease #1, but cancer's now surpassed. And it sort of flipped. And, you know, 5 of the top 7 killers are chronic diseases: cancer, heart disease, stroke, chronic lung disease, diabetes, So it's interesting. We're trying to figure out exactly why that happened, and some of it may be that we've been very effective and successful in some of our tobacco prevention activities. So you see that immediate effect more on heart disease, and the heart disease affects heart disease going down quicker, but the cancer effect takes a little longer.
Thank you very much for talking with us today. Very important topics.
Thank you.
Appreciate it. There's a good reason why we should all want to get chronic illnesses like obesity under control. As KXAN's Phil Prazen shows us, the right changes could save your life and a lot of your tax dollars.
These are my first sparring gloves.
Janae Hildreth looked away from the scale when it reached 240. She had to do something. It was simple, not easy.
I just looked up one day and I was like, wow, can't believe where I am right now. It hurt to bend over and tie my shoes.
She sheds the pounds at Ignite Fitness in downtown Austin and pays more to eat well. And the cost she bears saves us all money down the road.
So it's never too early nor too late to make a healthy change.
Dr. Stephen Pont knows that, not just because he was a bit bigger as a kid,
Pick out our budget gourmet TV dinners, and that would be what we would eat.
but because he runs the Department to Prevent Childhood Obesity at Dell Children's.
Obesity in adults and kids is for sure an epidemic in America.
He knows they should lead by example. Fresh gardens for kids, fitness centers for workers.
So now this is open 24/7 for associates to enjoy.
This at a time nearly 4 out of every 10 Texas tax dollars goes to pay for someone's health care.
1, 2.
So if your pocketbook had a voice, people like Janae would be the talk of the town.
Russian twist. The Russian twist is like what Fernando does in his class.
240 no more, but 70 pounds lighter. Not to mention a Golden Gloves competitor and one of the newest instructors at Ignite Fitness. Because when healthy living saves both lives and money, it's always a good idea to pay it forward. Phil Prazen, KXAN News.
Our roundtable has followed several changes to improve the state's health while saving money. Joining us, Ashley Lopez from KUT News and Edgar Walters from the Texas Tribune. Welcome to both of you.
Hey.
So with a renewed fight for Medicaid expansion, is this even possible? I'm hearing we don't maybe have enough money to pay for what some people have in mind next session.
Well, I mean, so what's in question here is a segment of our Medicaid budget, right? It's about $29 billion, billion with a B, in the past 5 years that paid for things like uncompensated care mostly, which is, when someone goes to a hospital and they don't have insurance, when a hospital takes care of them, those costs end up going into this like vat of money that gets paid off by the federal government. And so, I think the status of that is going to be in question because other states that have similarly not expanded Medicaid have lost a portion of that money. It's complicated, but it depends on how the federal government approaches negotiations with Texas, right? I would say looking at how other states have fared in those negotiations, Texas could lose a chunk of that $29 billion.
When it comes to reliance on the state, I know that health really is about a third of our state's budget. Certainly part of that is the Child Protective Services aspect, and I know right now they've had a lot of criticism because of a spike in kids actually having to sleep in state offices.
Yeah, that's right. There's a lot of scrutiny, as you mentioned, on the Child Welfare Agency, the Department of Family and Protective Services. When you talk to the agency, what they say is they're facing a couple of issues all at once. And primarily is just a lack of placements for children. So when a CPS worker goes into somebody's home and they decide that it's unsafe, they need a place to at least temporarily put that child. But because of a number of recent policy changes, there just aren't places for them to go. So what we're seeing is kind of two things. One, kids sleeping in offices, and two, as we reported earlier this week, there's also been a spike in the kids staying actually in psychiatric hospitals, sort of beyond their stay, basically because the state doesn't have anywhere else to put them.
Certainly something lawmakers will be talking about ahead of the next legislative session. We'll be right back with that. More from our roundtable in just a few moments. And how prepared is the state to actually battle the Zika virus concerns right now? And later in the program, transparency during traffic stops. How much is the Texas Department of Public Safety willing to tell you? Coming up on State of Texas In Depth. A public health threat that began this year in Latin America is now a major concern here in Texas. So far, we've seen Zika virus cases brought into the mainland United States. Transmission by mosquitoes is mostly limited to the Caribbean and South America. But as summer months warm up, doctors are still trying to understand what will happen here. Once again, we're joined by our political roundtable, Edgar Walters from the Texas Tribune and Ashley Lopez from KUT. Welcome. So Edgar, I understand that a lot of the leftover Ebola research funding was actually just possibly given to research funding for the Zika virus. How's that working, and what's going on in Texas right now?
Sure. So I think the primary concern on everybody's minds, at least among public health officials, is looking at how much time do we have before there's a mosquito to human transmission of the virus in Texas. So far, no recorded examples of that. But public health officials have gone to the legislature and said, you know, we think it's only a matter of time before that happens. Right now, I think a lot of the focus has been on prevention. Again, getting people at risk, people who have traveled to Latin America, and in particular, women who are pregnant or may become pregnant, the services and the screenings they need to make sure that they are not testing positive for the virus. Again, in Texas, we've got such a high population of people who don't have health insurance. We're seeing a lot of that sort of front lines work actually being done on sort of the nonprofit clinic level.
And as you mentioned, pregnant women are a big concern with this. What's happening with our fetal tissue research laws?
Yeah, so actually Texas is one of the majority of states that doesn't have any explicit or all-out bans on fetal tissue research. There are about 7 that do, Florida and Indiana being 2 of them. And so Texas has been able to kind of come to the forefront and start fighting, finding ways to fight Zika. Like UTMB in Galveston is now tinkering with a vaccine, largely because we have access to human tissue here. There are 2 hospitals in Houston that have already developed a rapid test for Zika. So because, there's only about 1 law regarding human tissue and research in Texas, the research community has been able to really jump in and start working on this.
It's certainly something we'll obviously be hearing about a lot more as we do warm up into the summer months and there's more mosquitoes. It'll be on top of mind for everyone. I appreciate you both being here. Thank you so much. Coming up.
See, I don't know that that's true or not. Just because you say it so doesn't make it so.
The Texas Department of Public Safety denying access to racial profiling complaints. What the head of the agency said. Welcome back to State of Texas In Depth. For drivers, this is an issue of transparency, knowing exactly how state troopers conduct themselves during traffic stops. We reminded the director of the Texas Department of Public Safety about a promise he made months ago, a promise to let you see his agency's investigations into racial profiling complaints against troopers. A promise KXAN investigator Brian Collister found out the director is not keeping.
DPS Director Stephen McCraw says his agency has nothing to hide when it comes to complaints of racial profiling and how his agency investigates them. He said so when asked about KXAN's investigation last November that revealed his troopers wrongly recording the race of minority drivers as white during traffic stops.
We don't just have data, we have evidence. So any member of the media or anybody else for that matter, and certainly the legislature, can look at every case that we have there's been an allegation of racial profiling, and not even look at the investigation, but look at the audio and video. So there's clear, compelling evidence.
But you'd be able to look at it on a case-by-case basis.
Yeah. But that has not been the case. We started asking last August for copies of every racial profiling complaint since 2010, but DPS refused to release them. The agency said state law makes personnel records of a commissioned officer confidential, and the Attorney General's office agrees. An officer has to be suspended or terminated in order for disciplinary records to be made public. And DPS says it has not confirmed a single allegation of racial profiling. So I caught up with the DPS director recently at the Capitol.
You said that anyone can look at any record from any allegation of racial profiling, but your agency won't give out
those records. So why would you say that? And does this mean a
I don't
policy
know.
change?
But see, I don't know that that's true or not. Just because you say it so doesn't make it so. So
Here's the record right here.
Let me check on it. I'll get back to you.
Well, your agency has denied access to these reports you want people to see. So why would you say that people can get them?
Well, bottom line is that I don't trust anything you say.
An interesting response, since the director did trust our earlier reporting that uncovered his troopers recording minorities as white.
You were right, and we were wrong.
Before the director's comments, DPS released only this single video. It shows a trooper stopping an African-American driver in East Texas back in 2013. Houston attorney Patrick Strong accused the trooper of racial profiling.
Running just because I'm black? Nope. Nope. Come on, man. I ain't no way I came all the way on this shoulder, man. Okay. But I understand. I mean, most people in authority positions, they don't like it when someone exercises their rights.
No. Why would I not like that?
I don't know.
That's perfectly fine.
Strong declined to comment about the stop, but DPS says its investigation found no evidence he was racially profiled. The agency says it only released his complaint and video because this trooper was given 30 days off without pay for other misconduct during the stop. It took DPS months to release the records of that misconduct, and last week we finally got them. They show the agency's own inspector general investigated and ruled this trooper did racially profile this motorist and others. But Highway Patrol supervisors later overturned the inspector general's findings, claiming that despite the apparent targeting of African American drivers, the investigation does not support sustaining allegations related to racial profiling. So is there a change in policy? You're not going to let people see those records?
People are going to see those records.
Director McCraw now says it was never his intention to imply that DPS would release all complaint files, only dash cam videos. DPS last week began releasing more videos from other complaints since 2010, but no document showing its investigation. Again, the agency says it has not found any evidence of racial profiling in any traffic stop. Brian Collister, KXAN investigates.
So how did that investigation begin? Coming up, we'll have a final word on this KXAN project months in the making when State of Texas In Depth returns. Last summer, KXAN began uncovering state and local law enforcement agencies wrongly reporting the race of minority drivers during traffic stops. Check out our full coverage online now at KXAN.com. But in that investigation, KXAN analyzed more than 16 million Texas Department of Public Safety traffic stop records and revealed the state law enforcement agency systematically underreported the number of minorities, mostly Hispanic, stopped on Texas roads by state troopers. Our stories questioned the validity of DPS racial profiling reports and led to immediate statewide changes in the way Texas troopers conduct traffic stops and record racial profiling data. We found the same problem in the Austin Police Department, which prompted an immediate audit of APD's traffic stop data and race recording practices, which found APD in violation of the Texas racial profiling law. And a final note, this week, the organization Investigative Reporters and Editors recognized that coverage by awarding our team the National IRE Award. That is our show. Thank you very much for joining us. Remember, you can watch every Sunday morning in the 8:30 half hour. Stay tuned for Meet the Press coming up at 9. I'm Josh Hinkle. Have a great day.